Nagaland records 14 fresh cases of COVID-19 positive, taking the total number of cases to 193. Nagaland's Health and Family Welfare Minister says new cases are from Dimapur, Twengsang and Mon quarantine centers. Mon reports 12 fresh cases. With 90% of the work complete in the ongoing installation works at CIHSR Dimapur for setting up of BSL-2 lab, Dimapur can see more tests very soon once the ICMR gives the go-ahead signal. And India's total COVID-19 cases rise to 3,54,065 today. Death toll reach 11,903. Active cases stand at 1,55,227, while 1,86,935 people have recovered. We are back at this time once again. Well, hello viewers. Welcome to News and Trends, and you're watching the daily news broadcast coming to you from the studios here in Nagaland. We look at the top story first. Nagaland today recorded 14 fresh cases of COVID-19 positive, taking the total number of positive cases to 193. Nagaland's Health and Family Welfare Minister said the new cases were from Dimapur, Twengsang and Mon quarantine centers. Mon alone reported 12 fresh cases. In his first tweet this morning, the minister said 2 new cases of COVID-19 positive have been reported out of the 314 samples tested, 1 each from Dimapur Quarantine Center and Twengsang Quarantine Center. Later in the afternoon, the minister tweeted again to inform that another 12 new cases of COVID-19 positive have been reported out of 238 samples tested. All are from Mon Quarantine Center. With this, the total number of positive cases now stand at 193 with 90 active cases and 103 recovered from the infection. With 90% of the work complete in the ongoing installation works at CIHSR Dimapur for setting up of a biosafety lab BSL-2, Dimapur can soon see more tests once the ICMR gives the green signal. Informing this, Managing Director CIHSR Dr. Sedevi told Deputy Commissioner Dimapur Anup Kimchi and Commissioner of Police Rotyu Tetsio that presently application process with ICMR is under process. Dr. Sedevi said all details would be sent to ICMR through a prescribed form and further videos of the work done would be uploaded, and once ICMR gives the green signal, the lab would be functional, Dr. Sedevi said. DC Dimapur and Commissioner of Police visited the CIHSR Dimapur to oversee the overall progress of BSL-2 installation, which is urgently required for undertaking more tests of COVID-19 samples at Dimapur. The Managing Director also informed that scientists from Jorhat would be arriving in Dimapur to impart training to the BSL-2 team.
The second company is a American company, so they are unable to produce enough, so it's not getting absorbed in India. Otherwise, this came to India much faster than it should have. The test.
Now they need more. So what test cut here? They have done millions.
Yeah.
It's काफी cut किया.
We aim at doing 1 million per day.
Per day.
Per day.
पूरा US का हो जाएगा. Whole country will be.
Yeah.
So UK does 1 lakh per day. So there is phenomenal investment in that.
India's total COVID-19 cases rose to 3,54,065 today, while the death toll reached 11,903, according to the Union Health Ministry. The number of active cases stands at 1,55,227, while 1,86,935 people have recovered and 1 patient has migrated, according to the officially updated figure at 8 a.m. India is the 4th worst hit nation by the pandemic after the United States, Brazil and Russia. According to the Johns Hopkins University, which has been compiling COVID-19 data from all over the world, India is in the 8th position in terms of death toll. Maharashtra has reported maximum number of cases at 1,13,445, followed by Tamil Nadu at 48,019, Delhi at 44,688, Gujarat at 24,577 according to the Health Ministry's data updated in the morning. In the northeast, Assam has reported 4,319 cases of the pathogen. A total of 1,092 cases has been reported from Tripura. Manipur has 500 cases. Mizoram has 121. Arunachal Pradesh has 95. Meghalaya has 44. And Sikkim has reported 70 cases till now. The total number of global coronavirus cases has increased to 81,73,250, while the death toll has increased 4,43,671 according to the Johns Hopkins University. With 21,37,716 confirmed cases and 1,16,962 deaths, the US currently accounts for the highest number of infections and fatalities in the world. In terms of cases, Brazil comes in the second place with 9,23,189 infections. This was followed by Russia with 5,44,725, India with 3,54,065, and the United Kingdom with 2,99,600. Regarding fatalities, Brazil comes in the second position after the US with 45,241 COVID-19 deaths. The other countries with over 10,000 deaths are UK, Italy, France, Spain, and Mexico. APC and Dimapur in charge for COVID-19 activities, Waikiketo Sema has rated Nagaland to be one of the best in terms of having quarantine arrangements, for which he attributed to the government, the frontline workers and civil society groups. Addressing media persons at Commissioner's Guest House, Dimapur today, Kiketo said compared with other neighboring states, Nagaland is extending the institutional quarantine days even beyond the 14 days, while other states are not in a position to keep the people in such centers even for 7 days. He said this effort is being made by the government to ensure safety of all citizens by testing all the returnees before sending them to their homes. He also brushed aside rumors that the government is declaring more positive cases to derive more money from the government, adding that there were no foul play in bringing the stranded citizens back to Nagaland.
It's in India. I think they are not in a position to keep their people in institutional quarantine even for 7 days. But we are in a position to keep for more than 14 days. Some have even reached 28, 29, 30 days. But for the safety of our people, government wants to see that each one of them should be tested, result should be declared, only after that to send home. That is for the benefit of that individual, benefit of that community, and benefit of that villagers. And people started telling that, I think it is some foul play, In order to get money from the government of India, I think they are intentionally declaring more positive. When there was no positive also, we were criticized. When more positive were found from Chennai returnees, again we were criticized. And again, when there is a huge recovery, again people are not yet satisfied. But let me bring to the kind notice of everyone that, yes, I think believers, Naga believers, they were praying for our people for many years. And I believe for those people, who were praying for us, we are harvesting now. And the overall percentage of the recovery is coming to more than 55%, And Dimapur alone, it is coming to around 71%, 71 to 72%.
He also informed that the quarantine centers in private schools and colleges in Dimapur would soon be freed in a phased manner since almost 96% of the returnees have arrived and gradually the returnees would be released from home quarantine. He further informed that a total of 6,800 persons have arrived in Dimapur through special train, 3,491 through normal trains, 904 by flight, 2,138 through buses, and 510 through other vehicles, bringing the total number of returnees to 13,843. A disinfection gas chamber and foot-operated sanitizer dispenser was installed at the Zinoboto District Hospital today. The disinfection chamber was donated to the hospital by proprietor MS Multi-Builders Hoto Jakalu, and a short inaugural function was held at the hospital premises. The chamber has an automatic sensor that can detect any person entering the chamber, which automatically sprays the disinfectants on the person's body entering it. It also has the facility of night mode and day mode. The district COVID-19 hospital has installed a disinfection gas chamber for all the medical staffs and others in general at the hospital and is ready for use. Dr. Shikato Yaptome, surgical specialist, while delivering his welcome address, lauded the President ZCCI for his initiative in bringing and installing it in the hospital and thanked the donor for his generous contribution. Kiketo Muru, President ZCCI, who also spoke at the function, informed that the proprietor MS Multi-Builders has not only donated the disinfection chamber but had also donated huge sum of money earlier to the district task force to help them fight against this pandemic. Deputy Commissioner of Zinoboto, Peter Lichamo, in his short speech expressed his gratitude and appreciation towards the love and donation from all corners that the district task force had been receiving, and disinfection gas chamber, which was the very need of the hour, was one of them. He added that it was very considerate of Hoto Jakalu and his family for having donated this very chamber to the district. The Deputy Commissioner inaugurated the disinfection gas chamber in the presence of all the medical personnel, Arto Inspector, Nagaland Police, who represented the multi-builders and others. With the sole objective of helping the marginalized students in our society, Green Club Zinoboto is initiating a project Students First, where 80 students have been identified from the different private schools in Zinoboto town who are struggling to pay the monthly fees in consultation with the school heads. These are the students whose parents are less fortunate than others, unemployed, daily wage laborers, etc., with some of the students likely to discontinue their studies due to financial setback. In a video, the club says that it did not want this pandemic to take away the right of the student to learn and did not want our future leaders to lose their birth prospect because of this pandemic. There are many among the identified students who have not paid the monthly fees for 3 to 4 months, and taking up these problems into account, the club has come up with this project to help the students by paying the monthly fees for 1 or 2 months depending on the contribution received. The battle is going to be hard and heavy, and without your help we cannot win this battle, the club said in this video. It is an earnest request to you to be part of this project with whatever amount you can spare and donate, and together let us help the students continue to learn and shine. It has asked donations be sent to the account number seen on your screen. The Zinoboto District Badminton Association, as part of its initiative to help fight the COVID-19 pandemic, donated 50 pieces each of mattresses, pillows and bed sheets for the inmates at Zinoboto quarantine centers. Now, in this battle against the COVID-19 pandemic, it is the frontline workers who are in the direct contact with the affected. Not many of us are aware of the risk they take and sacrifices they make, leaving their dear and loved ones at home and shouldering the responsibilities that not many of us wish to undertake. Yet despite all these, and more than being government servants, the medical staff, police personnel and the transport department, and you name them, they are at the front line 24/7 so that you and your loved ones are safe. These are in emotional expressions from a nurse and an NST bus driver telling us their side of the stories with tears and emotions. Let's listen in and give our biggest salute to these warriors.
quarantine duty lo dusa kere ke sa daut siamo de u job zo she u to responsible che government service side ni da hati ki crisis ti ki so u ke vi to customer shi so gonde she u penele ke ba mi zo o kere i po se vura mi tsu no to la so de kinyo de so u ri ji che penyo più non si un dolce di life support o pizza kai che penyo mettere mo c'è di forse che ne adesso vorrei spiritually mentally so non quiere se dovere mi una sapeva non va di tutti questo hai detto
Milanam Mahaze, Ami Dimapur unit la president se NST la family ke miss koraje le upai nai naga manu garni amakan sacrifice kurbo ino koraje aro tati koradam je positive lagi che gula family member ki bi aro varied group le to mon nai edo rai ni upai nai sacrifice koraje ni eti boy na rat bar din bar didi bola boy to lagi ase hole bi amakan lan nukuri to ase loka bonna pare আমি নিজের আমি কেয়ার করনে বেরে আছে মরলে বি বাঁচলে বি তো ঈশ্বর লাহাত আছে নগর না ছাড়ব
That's all we have time for in this edition of News Broadcast. But before we leave you, here's a reminder that you can send in your videos at the WhatsApp number flashed below and be part of this venture of being a citizen journalist. Do let us know what's happening in your village, your district, or your locality so that we can share it with the viewers who are watching this broadcast. Meanwhile, stay safe, practice safe health hygiene, and maintain social distancing wherever you are. But most importantly, take good care of yourself. Thanks for watching.